Hello. On behalf of the International Hospital Federation and the 44th World Hospital Congress, I want to welcome everyone to this very exciting fireside conversation with Dr. Wahid Majrooh, the former Minister of Public Health in Afghanistan. I'm conducting this interview on behalf of the Federation. I'm an honorary member of the International Hospital Federation, and it's a pleasure to be with you today. My name is Alexander Preker. Just as a quick background, I worked for 25 years at the World Bank, both as Chief Economist for Health and also in the International Finance Corporation, where I was head of health investment policy. Since I retired from the World Bank Group, I've worked as an adjunct professor in Columbia University, and I serve on the board of several organizations in the US and also with investment groups that focus on the health sector. Honorable Dr. Majrooh, first, I want to thank you, really warmly thank you and welcome you here to this session. We're very excited in the Federation and the attendees of this Congress to hear your view and to have this fireside conversation with you, where we would like you to share some of your experiences and your vision of the Afghan healthcare system. We're very excited to get these insights, particularly at this very difficult time for Afghanistan. And we hope to hear some of the things that you've recently been discussing with BBC, NPR, CBC. We've heard some of these things, and I think it's a very compelling story that our attendees and our members would like to hear. So as a start, could I ask you to please maybe share just for a couple of minutes with our viewers and our participants your own personal history that led you as a doctor in Afghanistan to become Minister of Public Health?
Bismillah ar-Rahman ar-Rahim. I thank you, the leadership and technical team of IHF, for providing this opportunity. It is a great pleasure and honor for me to be with you and the participants of the IHF Congress. For me, I'm a medical doctor. I studied here in Herat, in the west of Afghanistan, my medical university. I raised in a fairly average family from economic perspective. I studied medical faculty, then my first MA in political science here in Afghanistan, and the second MSc, which I'm just in the last step, is from the London School of Hygiene and Tropical Medicine through DL program. I joined the ministry about 6 years ago and as an executive assistant, where I served there just for a few days, and my supervisor, I never forget it, she came to me and said that, sir, you're overqualified. And then I walked through the steps in the ministry in 6 years. So I was not parachuted in the ministry directly as minister. I worked as a senior technical advisor to the minister, and then as a international relations director of the ministry for 3.5 years. At the same time, I was helping the ministry spokesperson as well. And during the peak of the first wave of COVID-19, I became the deputy minister for healthcare service delivery, where I was then promoted by His Excellency the President as the minister. I took the minister office in a while where there was a huge attack on the ministry and the public for corruption allegations, as well as the failure in service delivery, especially when it came to oxygen delivery in the first and lately in the second wave of COVID-19. So at the same time, it was joined with the escalating fight in the country. So I had to address the emergencies, but the president, Dr. Ghani, at that point, expected me to come up with a reform agenda for the health sector for what he was waiting for about 6 years. So it was a challenging situation for me. I had to address the urgent needs of the people in the health sector, which was COVID-19 and conflict emergency. At the same time, the vision of the former president to reform the health sector in a way that can fulfill the needs of the people.
Well, it's a fascinating story you're giving us here, and it really shows the opportunity you have had to have an impact on what's happening in Afghanistan on the health side. And I want to come back to a couple of those things again. Your personal history really emphasizes the importance of the country context to what happens in healthcare. Could you say a couple of things about the current socioeconomic and political challenges that Afghanistan faces? Before getting into the actual healthcare contents, what are some of the aspects that you take away from the context of the background that poses particular challenges, but maybe also opportunities for going forward in the future?
Afghanistan just experienced a very interesting and challenging 2 decades, where great opportunities, improvements, and developments is inherited as part of the presence of the international community in Afghanistan, as well as the damages to the social structure, social cohesion, the values, as well as the issue that we face in the governance, which is corruption. The former government was just stuck in the mixture of these challenges and opportunities, while suddenly the change, political and military change happened. Currently, the economy, the governance, and the social structure is completely faced with a huge psychological, economical, and structural shock. Unfortunately, it has badly affected all aspects of human life in Afghanistan. It has deep roots in different factors and role players, which I don't feel that the interview will have the opportunity for that. But as a youth, as a community member, as someone who was raised, studied, and worked here in this context, I believe that we are in a critical moment, an emergency, although the world has not accepted it as a global crisis, human crisis, but I can feel it every moment. It is not only a matter of unavailability of food, it is unavailability of a structure, it is unavailability of a value system, and lack of hope for people who raised in a balloon of last 20 years, which was suddenly blessed, and we fall on the same ground where we were left in the balloon 20 years ago. Health sector is not an exception. It is part of this tragedy. I hope that the current political structure, the civil society, and the international community can come up with a formation, with a structure, a solution that can not only guarantee the gains of the last 2 decades, which is the result of blood and treasure of our people and our international allies, as well as to ensure that we move toward a destination, a future that can preserve the values which ensures our social cohesion and unity in the longer term.
I think this really provides a vivid background, because you have described very well, up until 20 years ago, you were at a certain level in your economic development and your social development. Then the donor community came in, and you were kind of artificially, you called it the balloon, you were artificially put up to a different level. And if I understand correctly from what you've said in other interviews and what I've read, the international community not only provided technical assistance, but was also very instrumental in bringing in financial assistance that you became very heavily reliant on. If I understand correctly, the World Bank had a $500 million support system for you, and other, other funders came in. So during the last 20 years, you were really depending a lot on this financial assistance. Now, there's of course the threat that this may be withdrawn. What do you see as some of the options that Afghanistan has to begin replacing some of that international assistance with maybe some local funding for the health sector?
Which happened in Afghanistan is not an exception. If you go to different similar contexts of third world countries where the international community intervene with the project-based approach, and Hinduism culture is prominent there, same thing emerges, and unfortunately, same experience is experienced by other people in that context, and then the blame goes to the host nation. But the difference here in Afghanistan is that the addressing this failure of lack of sustainability in different aspects of life and development requires a settled situation where development aspects and sustainability of the achievements could be trust and then designed and followed up in a way that decreases the risk of collapse and disruption. But we are not in a normal situation to look through that lens. We were not out of the problems of unsustainability of the interventions of international community, while we faced another challenge in dilemma of change of political system and disruption of service delivery in the country. Something which I talked about it in several media outlets is that we were not okay, and we were not done with making the development achievement sustainable, where we came back to a humanitarian approach again. Now, which is required is an approach, a mindset that can not only look at the interventions from a humanitarian perspective, but creates and shows a linear association between humanitarian interventions, which is a requirement of today, and the development achievements which we had in last 2 decades. And that will not only ensure efficiency and effectiveness of the interventions of today, but also will decline the expense of the international community in the longer term, because it will help the Afghan society and the Afghan administrative system and service delivery capacity to maintain which is already achieved, as well as to build upon that.
If I can just pursue that point a little further, in South Asia, microfinance has been explored a lot in some of your neighboring countries. While you're waiting for the donor community to come back in with external assistance, and while you're waiting for the government to be set up so that they can provide assistance, is there a possibility that at the local level, you could have local communities start mobilizing some funds of their own that they would then pool into obviously not very high level care, but just basic care for the population?
Microfinancing is a practical approach which is experienced in different contexts in the region, but at the same time, we have to make sure that we do not replicate the failing examples of last 2 decades where prescriptions were written in other parts of the geography and then just administered here, and it did not result what we expected. The cultural context, religious context, as well as the foundation, the social and family foundation, which is the prerequisite for a successful microfinancing intervention, has to be ensured. Given my social knowledge, it takes time. It takes time to expose as well as to sensitize the society at different level to make sure that it does not repeat a failing example, as we had several microfinancing interventions in the last 2 decades where the input was there, but the output was not clearly observed and monitored.
Yeah, I think that's a very good observation you had. It's not the answer to all problems, but could provide a bridge mechanism. What about remittances, which often provide a very important source of funding. People from overseas sending money to Afghanistan. Now that many of the financial channels have been closed, I assume that also is going to affect remittances, where families may not be getting the support they were getting from families outside the country. Is that correct?
Yeah, based on an account that I heard, annually about 800 million to $1 billion was sent by Afghan diaspora to Afghanistan from different countries. And that does not work normally. That even adds to the challenges we have in Afghanistan. And I'm sure in the length of the interview, we'll go deeper on how these socioeconomic issues contribute and exacerbates the health condition of families, because based on the Afghan National Health Account, about 75.6% of the out-of-pocket expenditure is paid by people, meaning from $100, which is needed for healthcare, about 4.5% was paid by the government, 21% approximately by international donors, and 75.6% is paid by people. In current context, where the healthcare service delivery capacity has declined and the family and social economic situation is in the worst possible condition, the end result is increase in morbidity and mortality at different levels. And unfortunately, it will put our achievements in improvement, the improvement we had in maternal and child mortality indicators that we had in the last 2 decades, and it will even exacerbate the economic and productivity of our society in the midterm.
Yes, you have very vividly described in a couple of your other interviews how the Afghan system right now is on the verge of collapse. And as you get over this period of transition, which we hope will not be a long, painful process, but as you get over this transition, and the future administration will have to be looking at building up the basic infrastructure that you have just mentioned, is which has been destroyed during the process, the function of the health services, and begin also looking at some of the performance of the health service in terms of efficiency and equity, which I'm sure is a major problem also across the provinces. Where do you see, and this is all very complex, where do you see this starting and ending? What are going to be some of the initial priorities that the country will have to focus on in order to get the reconstruction process going?
Yeah, Said, I took the office when the health sector was under major focus of politicians, the government, and the people, where the COVID was out there, as well as the conflict emergency. The system is already strained with the increase in the demand, because normally about $300 to $400 million were spent by Afghans out of country every year seeking health care in India, Pakistan, and other parts of the world. When COVID-19 happened, borders were closed, and that put another burden on the shoulder of the hospital system of Afghanistan. COVID-19 itself exposed another risk to the system. The conflict emergency, which was unprecedented to having ongoing conflict in 34 provinces at the same time. It all strained the health system in a context where the Ministry of Finance was not able to fulfill our primary budgetary needs. In the last few months of the former government, we were not able to pay the salaries of our staff members, to procure medicine and supplies for our healthcare centers. At this point, the change happened in political and military system in the country, where it deteriorated the situation. Now, at this, based on information I have, access is how badly affected. In 2001, we started with 450 health facilities and 9% of people having access to healthcare services. When I left the ministry, We had 3,800 health facilities active, and based on the estimates, 93% of people had access. But unfortunately, closure of different health facilities due to unavailability of supplies in medicine, the brain drain of human capital, it badly affected the access. Equity, unfortunately, is another parameter of service delivery, which is negatively affected due to several reasons, which some part is more political, and it requires another opportunity to touch that point. Efficiency and effectiveness is something hugely under question. I hope that our UN colleagues will not bother. I normally tell them that, and I've raised my concern in different forums, that the ongoing competition on who will get a bigger part of the cake of the service delivery, which was normally through government and on budget, and now it goes off budget, it questions and it puts efficiency at risk. And I'm afraid that we will end up in a fragmented, inefficient healthcare service delivery system. That's why I always call for further coordination and establishment of a consortium where different role players can ensure synergism as well as inclusion of the ministry, because currently what I see and what I hear in the ministry as a mother institution and as a steward and leadership institution is completely marginalized, and it puts the institutional memory and capacity, which was developed in the last two decades, and was remarkable. And it is an asset for the government and our international allies. So it is normally just a mixture of problems, but I do believe that there are opportunities as well. I had chat with UN and ICRC colleagues, and I say that if you look at what was experienced in 2001 and then 2021, we can set an example that could be replicated for other parts of the world where they face the same dilemma and challenges we are facing now. Otherwise, you can create food for papers and journals for coming 2 decades of failures that we will unfortunately make in coming months and years.
Yeah, so these are very major challenges for going forward in the future. And I want to pick up on 2 points that you've made here and maybe pursue those a bit more. You had mentioned that in your previous work, you had been focused a bit on how to deal with the COVID-19 crisis, and you brought this up again, the disruption that COVID has brought to all countries, but particularly in a setting like Afghanistan. Can you say a few things about what has actually happened in terms of Afghanistan's approach to COVID, and where you see this heading in the next 12 to 18 months, as maybe the vaccine is becoming more available, and there's going to be more interventions available. To what extent has the General Health Service been paralyzed by COVID patients or not? And to what extent has the medical team in Afghanistan been able to cope with this crisis in this combined political crisis and now also a public health crisis?
COVID-19 was a challenge for all health systems, but especially for us. It was a challenge of leadership as well as resiliency of the health system. The first wave was a learning opportunity for everyone, especially for us in our context. In the third wave, we were able, hopefully, to set an example of successful management of the wave. We had our issues, we had our challenges, but in all those limitations where the government, the Minister of Finance, and the President was fully stuck with the ongoing conflict in 34 provinces, we were able to provide service and oxygen to the people in need. We could escalate and increase the testing capacity from 0 to 25,000 PCR tests in a day. the IPD capacity to 3,000 beds all around the country, a good, fairly good surveillance system. And we initiated the vaccination process. Our vaccine deployment, national vaccine deployment plan was appraised by Gavi and other partners as one of the best plans. And we had very successful and efficient administration of the first wave of vaccines we received. And the time I left the ministry, we had vaccinated about 7.6% of the population, but the last 1 month was completely disastrous because the conflict was going on and people were stuck in fighting and nobody could administer vaccines. But today, the testing capacity, unfortunately, is completely disrupted due to unavailability of the primary needs of the PCR labs. Human capital's salaries are not paid and they're completely reluctant and discouraged. Besides that, the vaccination still has not come up with a speed required to cover more people. That's why the fifth wave is out there in Iran, and even they're in fear of having the sixth wave before the end of the fifth wave. Pakistan is still struggling, and there is a high threat for having the fourth wave in the country, while there is no preparation for that. Unavailability of food, oxygen, and medical supply in the centers is another issue. When I left the office, we were able to install about 20 to 25 oxygen plants, but in the context of the fourth wave plan, which we had developed, we had proposed about additional 50 oxygen plants and 3,000 to 5,000 more beds in light of the surveillance data that will guide the implementation of the plan.
Well, I really want to congratulate, even with the short tenure that you had, because your tenure really covered the period of the third wave. So I really want to congratulate the response that you led in Afghanistan against this epidemic. And it's something for further conversation that I think is a good point to emphasize here toward the end of the interview, because the COVID crisis has really put into focus the importance of hospitals as a critical part of the whole primary care system. Sometimes we think primary care is only clinics in villages, whereas we've seen now with the COVID crisis that primary care only functions when you have the tip of the pyramid, which is the hospital sector that provides a backstop for conditions that cannot be dealt with in the clinic setting. And I think the way you've described here how you, under your leadership, Afghanistan was able to quickly expand their hospital capacity in order to deal with this increased load to hospitals. It's really just a wonderful story. And I think it's something that we should expand on further. We hope that there'll be an opportunity for you to come to join us in Barcelona, where you could maybe have side conversations with some of the attendees about some of the opportunities of learning from your experience. I'm sure the participants in the Congress would love to hear more about how you dealt with this, particularly with the resource constraints that you have in your country. In closing, I just want to say that the International Hospital Federation really stands ready to support Afghanistan in many of these challenges. The Federation is really the only body that globally unites the hospital sector across the world within an international focus. And I just wanted to ask, are there any immediate things that you think members of the Federation could do to help Afghanistan that you might want to bring to the attention of the attendees in the World Hospital Congress in Barcelona? And then maybe when you're there on your own in person, you'd be able to follow up on that conversation with them inside meetings. Is there anything that you could put on the table that maybe some of the membership might want to be thinking about before they meet you?
I really thank you for pointing at this very important part of the conversation. COVID-19, besides all other lessons learned, provided us an opportunity to reassess the value of the hospital institution in the continuum of care in different contexts, especially in emergency situations like Afghanistan. Unfortunately, during the last 2 decades, based on the prescriptions we had received, the major focus had been on primary health care, the basic health care at social level. And I used to say that the hospital sector in Afghanistan was an orphan. It was left out of focus, and unfortunately, no funding or donor major support was allocated. And that has resulted in a poor healthcare hospital system in the country, which we felt it during the pandemic. Although we were able to provide short-term trainings for our ICU and other professionals to ensure that we fill the gap urgently. But I believe that there is huge opportunity for different stakeholders, but specifically for the IHF members and the attendees of the Congress. I hope that I will get the opportunity to join them at this prominent event to share their capacities with the Afghan healthcare and hospital care system, specifically when it comes to human development, human capital development. The hospital management capacity is not optimal. It has unfortunately caused wastage of a lot of resources in hospital system. The focus of training programs in the last 20 years has been on public health specifically, but hospital care is left out of focus. So that's one part. At the same time, sharing the experience of emergency context is another excuse that can link up Afghan hospital system with IHF. I do believe that we have good lessons learned in that context. The days and nights where we were able to cover 400 or 500 injured people on the streets of Kabul by these hospitals is another part of the experience that could be shared with IHF members. So it is a mutual contribution. I believe that if I could join the event, there's a lot to further shape with our friends there. The last point that I wanted to talk about it, and I forgot it, is that something which was very important during those hard days and nights of conflict and COVID-19 for me as the minister, especially when I had to make the hard decision not to leave the country and stay in office. I served for 37 days with Taliban as well. Was ensuring the resiliency of the Afghan health system, as well as the impartiality and neutrality of the Afghan health system. I'm very proud that the system could prove its resiliency and COVID-19 as well as the conflict emergency. But I'm very sad today that that resilient system is at the verge of collapse. And I call on IHF members and the Congress participants to join voices and forces with us, calling on the international community not to abandon the Afghan health system and support it in a systematic approach, not a fragmented, competitive, inefficient mechanism. And we're also very happy, and I congratulate to the IHF and the Congress members as well, that the Afghan health system, as part of a larger global health community, could prove it is impartiality and neutrality in those days and nights where the conflict was going on in 34 provinces of Afghanistan. We're proud of our white gown heroes, and I share that pride with all members of the Congress.
I think that's a beautiful message to end on: resilience and neutrality. I really think this should be the phrase that we go forward with as we think of the next steps. So, Dr. Majrooh, I really want to, in closing, on behalf of the 44th World Hospital Congress and also the International Hospital Federation, I warmly welcome you to Barcelona in person, and thank you for having joined us today for this online video conference. And I do hope that you and I will have a chance personally to also meet sometime in the near future. Thank you very much.
Thank you very much, and I wish you all the best.